This is a really good time to look at the line, look at the insertion site, you get an idea if there's any drainage. Does it look weird? Do we need to culture it? Is this normally happening? Consider what we need to do to clean it. We may not need to clean it, and most of the time you don't clean it and rub it off. That's healing, so we want to keep it. But this is the perfect time to start looking at their skin without having a lot. So one thing I will mention, once you use the Tatchel, the Hem-Onc team did say that it creates this like film, okay? Sometimes you do need to like take your 2x2 that's in your kit and just wipe it off if you want to. I start with alcohol, it's not policy.
Sorry, can you rest it down? Thanks. Okay, can you raise your arm up again? Thank you. So, manufacturer recommends using alcohol to actually get the stat lock off. It says remove with alcohol. Some patients will tolerate the alcohol on their skin, some won't. So I actually like to use the alcohol on it. But if the patient does not tolerate it, there is a large detachable in the dressing change kit, okay? So we're gonna say that this patient tolerates it.
I don't think the teddy bear specifies with alcohol. It just happens to be this particular stat lock does say remove with alcohol.
I think
Does it say? Okay, never mind.
it doesn't sound like this on a patient. And I wouldn't dig this hard on a patient either. But the the adhesive is very, very strong. That's why we're excited to get some other products like the glue in place for the patients who do have sensitivities to adhesive. And you always want to use some sort of adhesive remover so you don't cause skin tears. So you see I'm like always holding on to the line here. At this point, I'm going to put my finger on the insertion site, flip this up, and get rid of that. Okay? So now I can start cleaning. Again, this patient doesn't have any allergies to chlorhexidine. So I'm going to hold on to my wings, and I'm going to start scrubbing. Okay? And friction actually is your friend when you're using chlorhexidine. That's an awful sound. It sounds like a chalkboard. And I want to go under that.
So you could go crisscross, circle, whatever, as long as you're going from out to in. You don't have to, it's not a circle out, you could do this, but if you do start the crisscross from the center area so you're not introducing.
And then I went over the top of the line and basically just cleaned under. Because you'll see a lot of patients get a ton of adhesive buildup there and it gets kind of grody. Okay.
From insertion site out.
Yes.
Always.
Yes.
So 30-second scrub, policy says 30-second wait, but really you wait till it's totally dry on the skin.
Exactly. And this is kind of the tricky part.
Which is not 30 seconds, ever.
No. You want to make sure that this part is, getting some air under here. So a lot of times I'll let the insertion site dry and then I'll just kind of bounce up this wing so that it gets some air.
You can utilize this time to foster therapeutic relationship with me. Can you tell I'm doing my exemplars?
What do you like to do in your spare time?
Well, I like to get my dressing changed.
All right, so I just got my no sting barrier, and I prepped everything, so I don't know if everybody saw me. I basically just got this out and like flung off the paper so that I can do most of my stuff one-handed. So you want to go everywhere where the dressing will be except for the biopatch circle, because you want CHG on the skin, not skin prep, okay?
They call this the lollipop. Some of them, I call it the lotion because it doesn't sting them. But of course they could tell you, they just don't like, some kids just don't like any of that.
And these are the fun teddy bears. So these notches do move, see that? And then they do have an arm. So if you have a patient who has like a short ECL, what I will do, before I actually put it on the patient, external catheter length is ECL, sorry. So if they don't have a lot outside the body for you to work with, I will fold down those paper edges. Most kids don't like that because it's pokey. And then I rip off the teddy bear's arms. You're not gonna get this off of your finger, your sterile glove, so just leave it there. It's sterile.
Practice before you do this with
Okay.
just any other teddy bear.
So I'm holding the insertion site in the line pretty tightly. The teenager is tolerating my presence still. And when I say a short ECL, I even consider one a short ECL. Okay? And now you pull off the wings. Got the legs down. Now you can start breathing again, and the sweat is still coming off your forehead, but it's okay.
Now, when you do anchor it, say it has a 4 ECL, you want to
Hey, don't touch my sterile field. We got to start over, kid.
You're gonna want to loop it. Okay, make a J. Don't make it too tight so it doesn't kink. Away from the armpit, away from their inner body, so it's always on the outer arm.
If it's a Broviac or a Hickman on the chest, try to avoid the nipple area. If it's a woman with breasts, anything like if there's cleavage, you want to try to get it on the flattest surface area possible, those type of things. And then you're gonna put on your bio patch, okay? This is the small one that is in the kit, okay? It's over top. I'm still holding it because I've had the bio patch pop off of there. So I kind of just get it. Oh, and in the sterile dressing kit, there is 2 sterile gauze if you.
I use the sterile gauze because
Choose.
I don't like to put my finger on that sterile insertion site. It's not policy though that you need to use the gauze, but it gets slippery for me, and I just want to make sure I have something to keep between me and the line.
So it's important not to stretch these. Stretching it actually can cause skin tears as well. So you basically want to place it on top. You get your line out, and then you smooth it all around. And actually, the way to get this secured and sealed is go around the side, just starting every little, and then it actually helps with the heat of you pressing on it and the heat of the skin to seal it. And we can't stress enough to actually use the kits because it is more efficient, and then it also is part of national standards that kits are used and help with CLABSI reduction. And these are the pants. You all know what the pants are, right, on the dressing. And then in your kit is your pen. So I'll date and time it. Or no longer time. Just date.
Date and did we do it? We did
Initials.
Don't tape over a joint, so if it's near the AC, just loop it up as best as you can. So get creative with your positioning of that, so we don't have it in a joint, especially legs and arms.
And then I would probably give them a new stockinette, a clean one that's not gross and dirty from playing outside. And then I would send them home with a couple as well.